Hi, I'm Dr. Ryan Sinclair, and today we're discussing how policy is made within the United States. Most people aren't aware of how policy is developed, implemented, or enforced. We are not aware of it until it personally impacts us. So today we'll talk about the process along with the individuals and groups of people who have the most influence on policy. So, what is policy and how can we define it? Policy is a course of action which ultimately influences the behavior of people. Specifically, public health policy walks a fine line between government, organizations, and people to balance and protect the public's health or the people's health. A great example of this was the Pure Food and Drug Act of 1906, and that's still with us, and it evolved over the last century and was most recently updated in 2007. This policy was drafted to protect public health by implementing laws for the sale of goods consumed or ingested by the public, including food, drugs, alcohol, dietary supplements, and other items. Before this policy was passed, people could manufacture and claim anything about their products. Above, I have some pictures here of why this was necessary. There's some examples of potions and other products available to cure most anything. Often these products contain toxic materials like arsenic, mercury, cyanide, or even tapeworms, like this advertisement right here. So there's several types of public health policy, and in order to reach this balance between the government, organizations, and the public, there's two main types of public health policies: the interventionist policies and the influential policies. So interventionist policies are those that define the powers and functions of governmental agencies at all levels. Police powers are an example of which are given by the constitutional authority to state and local governments to regulate businesses and individuals to protect public health, and quarantine is a good example of the use of police powers to control people for protecting the overall public's health. So that would be quarantine as a police power, which is considered an interventionist policy. The other one is influential policies, and those protect health through incentive methods, such as taxes on cigarettes, which is a disincentive to buying tobacco products. Research has shown many times that taxation is a strong influence over public health. So this is a picture here of some cigarettes, and with all of the taxes on there, they are up at $5.54. I think that price is even higher now in California. So how is policy made? Policy is made through several actions and even inactions. It doesn't happen on the whim of a person or even an organization. A lot of thought, debate, research, data, and even actions go into making policy in this country. So there's several ways policy is made. The first way is authoritative decisions, which are made by those who have the power to implement and enforce the policy. Governments at the federal, state, and even local levels can pass policy in the form of statutes, also known as laws, or ordinances, which are policies at the local level. Organizations can also pass policy for the benefit of its members or employees. An example of an authoritative decision is to halt the spread of communicable disease. Another kind of policy is called a course of action, and that can be developed and implemented at any level in a government, by an organization, or even by individuals. To follow the example of the communicable disease prevention, a surveillance and monitoring program is one that's developed at the state level, it's implemented at the local level, and it reports through the state to the federal government, in other words, the CDC. So that would be a course of action, more of a program. Authoritative guidelines are also a method to develop policy. They're developed to describe implementation of policy or develop an unofficial policy where one is either absent or isn't descriptive enough. The state of California has a policy governing underground storage tanks for petroleum or other hazardous materials. This policy is implemented by the State Water Resources Control Board through the development of regulations which describe how the policy is to be implemented. Finally, inaction is another form of policy decision which essentially fails to change an existing policy. An example is an existing workplace formaldehyde exposure standard, which was not updated to a lower exposure level due to the lack of support and perhaps inadequate evidence to require a policy change. By not amending the formaldehyde standard, the inaction communicated that the existing policy was considered adequate as it was written. So again, that's 4 different ways that help establish policy: authoritative decisions as policy, a course of action as a program, authoritative guidelines, regulations and standards, and inaction. And all of those can format policy. So who develops policy? Well, everybody wants to try to do something towards development of better public health policy, but who really makes those policies? So all branches of government develop policy. At the federal level, the 3 branches of government develop, apply, and interpret policy, along with administrative agencies to implement and enforce policy. State and local governments implement policy through elected officials and administrative agencies similar to the federal government. However, states are given more control over policy implementation by the Constitution for several reasons: balance of power, increased span of control, smaller geographic area to cover, differences in demographics, physical environment, and sources of funding. The state government will use permit fees more than tax dollars sometimes. There's also differences in interpretation of national policy for the state and local governments. There's also other groups that develop policy. Organization, workplaces, school districts, colleges can also develop policy. This graphic depicts the 3 branches of the federal government. The legislative branch makes laws and is made up of elected officials which make up the U.S. Congress. The executive branch approves bills by signing them into law and includes the president as the chief executive officer over the cabinet. The judicial branch interprets law through federal and Supreme Court systems. Not listed on this graphics are other constituents who are stakeholders in the policy: the political party, foreign governments, international organizations like the WHO or the World Health Organization, and ultimately the public, since the laws passed at the federal level will affect everybody that's in our country. So that's the 3 branches of government at the federal level. Now let's look at some other levels. Here's the state level right here, and this is the 3 branches of government at the California state level. And in this level, we also have an executive branch, a legislative branch, and a judicial branch. And if you notice on this slide, there's also this here, the branches of government at the Riverside County level, and they're connected with these arrows, while up here at the state level, the arrows are absent. And the reason I'm doing that is to show you the separation here of these different branches. The Riverside County government structure includes the Board of Supervisors, who are elected executive authorities for the county. They also have a quasi-judicial authority. The county administrator works closely with them, and they're not as separate as the state or the federal branches of government. Other departments in California counties include administrative, agriculture, assessors, child support, county clerks, environmental health, health service planning, and personnel and others depending on the state and the county. So again, the state level branches of government have 3: executive, legislative, and judicial, while the federal also have 3: legislative, executive, and judicial. If you go back here, the arrows that connect these are definitely stronger on the county and local level governments, while the arrows are not present here at the state level or at the federal level. So let's look at the hierarchy of how these things are all connected together. So this is a simple depiction of the hierarchy of police powers and development in the US. At the federal level, general policies are made like the Clean Air Act, which is an environmental policy, or the Medicaid Act, which is healthcare for the poor. For these federal policies, the states must implement the federal policy or pass a more stringent policy. The Constitution's 10th Amendment gives power to the states to implement and develop policies while limiting the reach of the federal government beyond the executive, legislative, and judicial branches. To follow the federal policy example of the Clean Air Act, California chose to develop and implement a more stringent state-level policy for clean air and has adapted and updated this law as recently as 2006, which addresses climate change by reducing vehicle emissions. In contrast, the Federal Clean Air Act was last updated in 1990. So where do counties sit in regards to policy? Usually counties implement state-level policies and report back to the state annually on their progress in regards to enforcement. Unless a county develops its own policy, it will implement the state's policy on behalf of the state and often receive funding to do so. One important thing to consider here is with the 10th Amendment, the states are given the ability to implement and develop policies and limit the reach of the federal government beyond the executive, legislative, and judicial branches. So there's some interesting public health in practice concepts that come up when you think about the difference between the U.S. and state in terms of policy and the 10th Amendment. So who influences policy? This looks similar to the slide where I say who develops policy. We've seen the levels of policy making from federal to state to local agencies. Now let's look at who actually influences public health policy. Obviously, Congress influences policy not only by passing national level policy for the entire U.S., but also for providing funds to states for oversight and enforcement of specific policies. We'll discuss this more under the finance module. Little enforcement happens at the federal level unless there is a challenge with a particular state. An example of this happened several years ago between the federal government and the state of California for what the feds considered a lack of oversight and enforcement of healthcare organizations by the state. With the threats of the feds pulling financial reimbursement, the state was forced to increase its oversight activities by hiring more healthcare surveyors and following up on complaints issued by the public. This list also includes special interest groups, which have gotten a negative image recently. However, these groups are crucial to public health because they influence policy outside the governmental hierarchy. These groups represent the interests of their members and have the ability to influence policy through different activities. Grassroots actions come from the organization through its members in the form of specific actions, such as contacting their congressional representative to ask for support or opposition of a specific policy measure. Grass top utilize leaders and other prominent community officials to support or oppose policy initiatives. Coalitions are groups of organizations who unite around a specific cause. This is effective if they have a common message and a cohesive strategy. Media campaigns can effectively communicate a message to the public and other groups. And finally, funding is another strategy to help interest groups gain support. This could be funding an organization or a political campaign. Each one of these groups has the ability to influence public health policy in a positive way. Often, those are at the upper levels of the policy hierarchy and aren't aware of the evidence or importance of a public health issue. A recent example of influencing public health policy was a group of deans from the schools of public health testified in Capitol Hill in early 2017 on the dangers of opioid overprescription and addiction and asked Congress for help through national policy. So what are the sources of policy? Again, this is real similar to this last slide on who influences policy, where the sources of policy are reinterpreting and reimagining constitutions. In other words, the policy to form a government along with the rights and obligations of the government and individuals. Also, policies are published as statutes. They're also considered common law, which is court interpretation of laws, and they're also enforced through administrative regulations. Thanks for watching. I hope this gives you a good overview of policy. We're going to do a deep dive into more policy as we go on with this series, but I wanted to give you the introduction and basic layout of how policy is made and how our different layers of government